Hi, good morning, everyone. Welcome to the fourth installment of my Pulse Live webinar series. This is a platform where we explore key topics and support our wellness journey here at Massy. My name is Akin Fitzandrews, and I work within the Wellness and Benefits Department here in Trinidad and Tobago. Today's session is entitled Men's Health Matters, and it's all about focusing on health and well-being of men. Far too often, men delay care, dismiss symptoms, shy away from conversations about health. And while this webinar is here to change that by encouraging awareness, prevention, and empowerment. We are honored to be joined by a distinguished medical professional, Dr. Broom Webster, who brings a wealth of experience and passion to this conversation. Dr. Broom Webster is a consultant family physician with a solid educational background, having earned his MBBS and Doctor of Medicine in Family Medicine at the University of the West Indies, Cavell, and a Bachelor of Science in Sports Medicine from Howard University. He currently serves as a clinical director at Diagnostic Medical Incorporation, where he leads with a commitment to patient-centered care. His dedication to community wellness is also reflected in his past service as the Public Relations Officer of the Barbados Association of Medical Practitioners, where he championed public education and advocacy. We are grateful to have him here today to guide us through this important topic. So let's dive in. Welcome to Men's Health Matters with Dr. Broom Webster.
Yeah, sure. And that's my cue, right? All right, so let me just share my screen. I'm not as familiar with Teams, so bear with me. Cats and share window. All right. Can you guys see the presentation?
Yes, we see it.
Okay, good. All right. Let me. Right, good. So this morning I wanted to talk a little bit about men's health. First of all, I would like to thank the Massy team for inviting me to present this important topic. I'm having a little trouble with the presentation. Let me figure this out. Because I want to be able to see you guys too, but that doesn't seem to be possible. Oh yes, I can do that over here. Right. You guys are still seeing the presentation, right? At this point in time?
Yes, but I'm seeing it small on the left. I don't know if that's happening for anybody else. Are you seeing it full screen?
No,
No, it's small to the left of the screen.
Yeah.
Okay, so you're seeing it full screen now, right?
No.
Not yet. No.
Not yet.
Okay, I put it as slide.
Also,
Okay.
your
That's
it.
volume keeps going up and
Yes.
down.
Looks good. Great.
Yeah, so you can see it full screen now.
Well, I'm still seeing. If you click from beginning,
Yes,
it should be okay.
Is it there now or no?
Not yet.
I'm just trying to figure out what it is I'm doing wrong. Let me stop sharing. Let's share my entire screen, see if that works. And then what I will do is go to presenter view.
Yes.
Is that
perfect.
better?
Yes, perfect.
Yeah, good. Okay, trying to be too fancy. Sorry about that. So yeah, thanks guys. I just wanted to have a conversation this morning about men's health. Obviously, being a man, this is an important topic to me. I wanted to congratulate Massy first and foremost for having these kind of webinars. Obviously, discussing health in general and wellness is something that's important to society, but it doesn't always raise its head in the corporate conversation. And despite a lot of conversation around corporate wellness in the space, companies actually taking the effort to champion these kinds of initiatives is something that I would say it's been happening a bit more frequently, but to make it be something that is actually sustained or sustainable is not as common. So it includes obviously the administration, but the people, all the evidence really shows is that the persons who really maintain this level of corporate wellness are the employees and the entire organization. You guys have to set up a wellness legacy to champion this kind of stuff. And if that happens within the organization, usually all wellness will improve as time goes on. So I just want to spend a little time today. Hopefully we can get through the presentation reasonably quickly, because this is just an opportunity to set the stage for conversation. A lot of these things that I am talking about may not dive into super detail, but it just sets a framework for you guys to have a robust conversation, maybe for about 10, 15, 20 minutes towards the end. So I'm just going to introduce a little bit about men's health, talk about the different aspects of men's health: physical, mental, preventative, specific conditions that I think are interesting that you may not hear about regularly, and then some practical tips. Now, with the major issue that people don't sometimes understand is that there's a significant gap in gender-related health, and when it comes to men, our life expectancy is less on average. We have about 60% of all the all-cause death that happens in the Americas happens because happens in men. They're low screening rates, with only really about 3 in 10 men. 3 in 10 men report that they've actually ever done any type of screening at all for any disease, which is quite a lot. So 70% of men are not really getting the type of screening necessary to facilitate proper health. And we really like to improve that. So, coming out of this, we hope that we could double that amount, at least within the organization. I don't know what those baseline levels are like, but I also would like that peer support groups are another big part of the conversation. So someone's mic is not working. Yeah. So, establishing peer support is a big part of men's health. And unfortunately, men don't usually come out and converse with each other in the way that we would like and communicate in the way that we would like. So creating those sustained wellness and health awareness groups are always going to be helpful. And that's where My Pulse and Massy also does a good job, because it can happen at the company level, but also at the community level. So this is pretty much similar to what was discussed before. We're going to go through the foundations of health, preventative strategies, practical tips, key takeaways, and then have some conversation about the issues. Major issues to talk about. In general, this is not done well in the Caribbean. We have a low consumption of fruits and vegetables. Obesity rates are really high, particularly in Barbados. The obesity rate for adult men is about 20%. It's slightly lower than the regional rate, but again, it's still quite high compared to global rates. Lots of consumption of ultra-processed foods, and there's a big variation in the region. A lot of that has to do with access to foods, but the overall thing here is that we need to improve our diet in order to do better, which we know already, but sometimes the stats can help us facilitate that. In general, men are not that active. About 39% of Caribbean men report being inactive. That definition may seem like a lot. Even myself, I find it quite difficult to meet the definition, which says you have to do 150 minutes of vigorous exercise at least. So that works out to being like 30 minutes 5 times a week. But that's the kind of dedication and discipline that's sometimes necessary to improve your long-term outcome. So that's what's recommended, and as a baseline for where these statistics come from. And we know that regular exercise will reduce your risk of developing cardiovascular disease, so things like heart attack, stroke. So getting into a habit of doing it in some way, again, there's an opportunity for corporate wellness initiatives to incorporate movement in their daily activities, and it's something that we everyone should consider getting outside and doing something, even if you can't do it on your own. Sleep is a big problem for lots of men. Not something that's talked about regularly. In Jamaica, we notice, there's about 20% of some studies coming out of Jamaica show that men have sleep apnea, and these persons with sleep apnea, 1 in 5 of those will develop hypertension. So the important clinical scenario to remember, a lot of times we talk about hypertension, diabetes, as the main NCDs, but there's so many other factors that link into these conditions being so serious. And a common cause of hypertension that's not always recognized is sleep apnea, where persons are snoring, waking up from sleep regularly, and this just drives them to have these very, very high blood pressures. You may notice them sleeping in the office, you may notice them falling asleep in an industrial task, and it becomes really important for occupational health to recognize these persons, because there is help for them. They can get assessed and they can be treated to make sure that they don't have any accidents, not only on the job, but at home. Sleep insufficiency is a major problem worldwide. We know that chronic sleep deprivation increases the risk of NCDs and certainly affects your ability to focus while doing your various tasks or caring about your daily life. So it is something to think about. And getting 6 to 8 hours of sleep is a lot more important in your reset than we give it credit sometimes, where we're just trying to run ourselves ragged, working hard all the time. So lots of men report specific issues, not unique to men. So in no means am I not including the ladies, but this is a conversation about the men today. But many of these issues will overlap, and it's just about bringing attention to male health issues. Yeah. So high daily stress, 1/4 of men worldwide report that they're very stressed out, and they don't know how to deal with it. So things that can help, mindfulness practices, taking time, mindfulness can take a various, many different iterations of mindfulness exist. So you can have some persons are very spiritual. Some people may meditate. Some people go to church. Some people pray. But the point is that you need to take time for yourself to process or reduce these levels of stress. And mindfulness is one of those activities that can assist. There are multiple, as people say, there's an app for everything. There are lots of interesting health applications. There's one I use called Wake Up, which is nice. There's another which really helps more with meditation and clearing your mind and stuff like that. There's an app called Headspace, which is quite popular. Some people may be familiar with those, but they really do tend to improve resilience. And obviously your peer support from work to home. You need support to be able to navigate the difficult portions of life, and not having that support can put you at a big disadvantage. Yeah. So it is important, as I said before, to strengthen social connections. Make sure that you have strong networks. All of these things will lower your symptoms or likelihood of developing mental health disease, so depression, anxiety, loneliness. And working on your communication skills, where you take the effort to try to navigate difficult conversations. Don't run away from them. Interact with people to try to navigate difficult situations, because this will only bolster your resilience in the long run when more difficult issues come up. And family or couple therapy, a lot of people have difficult relationships, whether at home, in the office, and these are things that we have to pay attention to, particularly among our men who don't really like to come out and say anything. Finding a group of people to talk to or engage with about your issues can be more helpful than you could ever imagine, especially for someone who is completely naive. And many of us as men don't really engage in this practice at all. So other important risks in Caribbean men's health to address. Men generally will engage in more risky behavior. This doesn't start from adulthood, it starts from childhood. From the little boys more likely to jump off the table or jump down the stairs. It's just innate, and it's something you need to be aware of. Obviously issues like sexually transmitted infections, unsafe sex, early pregnancies, excessive alcohol and drug use are all issues that early intervention and education does help. Okay, so just talking about it, just saying to someone when they come into a consultation or having the conversation in the office to just remind somebody, well, look, you don't need to, try to cut back a little bit on this or cut back on that. You'll be so surprised how a little education and visualization can just remind people to cut down their behaviors to safe levels, to something that we can tolerate. Yeah. And I think that's really important to remember, because it means that you don't need to do a lot to make a change. You just need to sometimes remind people. And this is particularly true with alcohol use. So in general, as we said before, men don't really go to get checkups. They also don't do any, they don't do a lot of screening in comparison to their female counterparts. 1 out of 3 men over the age of 40 can have high blood pressure at a clinical consultation. But if most of those men are not even going for the check in the first place, whether it's hypertension, diabetes, cholesterol, PSA, colorectal cancer screening, there's no way that you would ever know. And when you have a prevalence that can be as high as 30% in random checkups, you could imagine how many people may be missed, where sometimes just some education again about their behavior can change this outcome for these men. The other big issue that comes up with NCDs is cancer risk, prostate cancer mortality. That just means the risk of dying from prostate cancer in general seems to be higher in this part of the world. That some of that is genetic, some of that is situational due to the health system. And really and truly is important that we undergo screening. The high yield screening for cancer in particular that we talk about is PSA, which is a blood test for prostate cancer, as well as colonoscopy screening. Now, colonoscopy is not the only type of screening for colon cancer. Importantly, there's a simple stool test. Many national programs globally use these stool tests to check for colon cancer, and is a very cheap, accessible, easy to use, and very reliable form of testing, which can prevent against colon cancer. So these are things that you really should try to do. If you get annual checkup and you're of the age, any guys over the age of 45 in general really should have colon cancer screening. In the Caribbean, sometimes we'll start a little earlier for prostate cancer, somewhere between 40 and 50, even though a lot of the guidelines may say 50. And that's because we're concerned about this 2 to 9 times higher risk of dying from prostate cancer. So we tend to screen a bit more aggressively sometimes. Importantly, there are pretty high rates of heart attacks in the Caribbean. And we know that controlling blood pressure, reducing cholesterol, and controlling all the risk factors that are associated with these high rates of myocardial infarction. Also, strokes are really, really high, particularly in Barbados. We can make a huge difference, up to saving at, decreasing cardiovascular disease by 25% and decreasing the risk of stroke by 30%. Now, stroke in particular is quite catastrophic for anyone who's ever been through a situation where a relative has had a stroke, and that changes your life immediately. And in many cases, especially if, unfortunately, you don't want people to lose their life, but if it's not a fatal stroke, you deal with the disability of the stroke for the rest of that person's life. So, something as simple as taking a tablet or doing lifestyle intervention to make your blood pressure better prevents these things from happening. In very real terms, it's something that is not hard, it's difficult to resonate because it may not have happened to you, but it happens every day to our Caribbean brothers and sisters. And it's something that I feel very strongly about because I've seen it happen to people as young as 35, 36. People lost their life in their 40s because of these issues, right? We need to pay attention to them. So some interesting issues that I know lots of men talk about, and I'm sure there will be lots of questions around these next 2 slides. But important to know as well is that all of these, and the point I really want to make is that all of these NCDs that we talk about, non-communicable diseases like diabetes, hypertension, heart disease, everything is interlinked with some of the more concerning issues that men really face. A lot of guys will say, come into the office and say, well, I'm not interested in having sex anymore, or my libido, I feel like I'm not there. Is there a problem? Or even in terms of having erectile dysfunction, where their sexual function is not where they expect it to be. They can't maintain an erection. They feel, they're concerned about these issues. And this, what I find interesting about when men come to the doctor is that lots of guys will only ever turn up to the doctor when an issue like this is happening. But it really turns into a segue that you can then intervene in all the other issues that are contributing. Because the reality is that while low testosterone is prevalent, I mean, it can be as high as 40%. Hi, morning.
What?
Oh, sorry. I heard somebody say something.
Oh, no, no.
Okay, cool. So while low testosterone is a major issue, understanding how to treat it, what are the things that cause it, these conversations can become very important, because testosterone itself, in most cases, is not driven by a primary or secondary cause. Most of the time so while that can happen, most of the time when we see men present in our setting, a lot of times, as you can see in the impact in Caribbean men, there are multiple things that are contributing to this late onset or what we would call late onset low testosterone. And it's very important to understand what's going on when that happens. But the truth is that low testosterone does happen. There are indications, especially if you have persistent symptoms with sexual function, with muscle mass, with bone health, and your testosterone is low, that you should supplement it. But it should be done under the guidance of a physician, because in many cases, a lot of men are using testosterone and it really is not indicated. And at the same time, there are lots of risk with using it. So it can, theoretically raise your PSA. So while it may not cause cancer, in raising the PSA, it makes it difficult to interpret. And therefore, it can also suppress fertility. And that's the other big one. So, if you're a younger person, you're having an issue, and you're using testosterone randomly, similar to anabolic steroids, it can make your actual fertility very difficult, because it affects the way sperm is formed. Okay. So this is something that will come up commonly because it's very, very prevalent in the media space and the market space. But it's something that us physicians have to understand intimately, because people ask about it a lot. Do I need some testosterone supplementation? I need a lift in my vitality and energy. And sometimes that can be fixed with just exercise and diet and lowering the amount of smoking you may do, or alcohol, or sleeping a little more. A lot of the basic foundations that we would have discussed already. All right. So the other big issue, which is interrelated, is erectile dysfunction. Now, this in areas where these studies have been done, some people report as much as 41%, 4 in 10 men have some issue, maintaining their sexual function in a way that is considered to be normal. But the important part of this whole slide is that, again, when you have chronic diseases and you've been having them for a long period of time and they're uncontrolled, they will impact your ability to have normal sexual health. That's similar for women as it is for men, but in particular with erectile dysfunction, you will see with end-stage renal disease patients, which is ESRD patients, they have as much as 9 in 10 people, okay? And that's because the major cause of erectile dysfunction is sometimes vascular, which means that the blood supply is really poor to this part of the body. And in end-stage renal disease, this happens a lot, okay? So again, another issue, treatable. There are things you can do to help this problem, but I just want to make the overarching point that all of these things, when it comes to men's health, are interrelated. While these issues may come up as sometimes the most pressing or important, they end up being interrelated to everything else, okay? Sorry, lost my slide there. Right, so another big issue, this is an issue for lots of Caribbean couples that people never talk about because it has a lot of taboo around it. You may have that person in the office or somebody in the family who has been married for a long period of time. They haven't had kids, and somebody heckling them or giving them a hard time when really there is a problem, right? And sometimes this is not something that's talked about, but it's something that needs a little more attention. And importantly, about 50% of cases of infertility are really due to male factor infertility. And in most cases, when we say male factor infertility, what we really mean is that there is a problem with the sperm. It either is not working properly in terms of moving around, it has an abnormal shape, so it cannot undergo the natural processes to fertilize the egg. And these are issues that sometimes have to be looked at. Again, the major treatment for male factor infertility lies in the same thing we would have discussed earlier, all of those lifestyle interventions that can make a huge difference. And in particular, it is a very sensitive topic, but men need to be open about addressing this if they're interested in having a family and having these conversations with their partner, because the reality is that is a very vulnerable feeling for men in particular when someone says, well, look, something is wrong with your sperm or whatever, you know. The fellas will tell you to go and eat some okra or drink some sea moss or do whatever you need to do. But the truth is that sometimes you do need fertility input to try to help this problem. And a lot of times it comes back to your lifestyle in terms of improving these chances of having, you know, a successful pregnancy and building a family. So, you know, briefly just go through some of the basic principles that we can do in terms of our activity, something that is actionable. I think this 3-step routine is a good one. I was looking for some easy things to remember. That's the hardest part. You probably are a bit tired of me talking already. So you can add 1 extra fruit or vegetable to your meal for 3 weeks to reinforce your healthy eating habit. Make sure to schedule short activity breaks. Again, the amount of activity you do just needs to be vigorous and spread out through the day. It doesn't have to all go in one sitting. So sometimes taking a walk around or having a quick 5-minute activity break is useful to maintain your focus, but also enhance your energy levels. And tracking your behavior. Everyone has a watch. And tracking your behavior and making sure you understand how things are going is really important to build lasting habits. So that's a 3-step routine that you can consider. And then, you know, in more detail, setting SMART goals. So SMART goals are about specific, measurable, achievable, relevant, and time-bound goals. And in broad terms, you just need to be able to monitor what you're doing. You need to be very focused about what it is you want to do, no matter how small. Set something that's achievable, even if it's walking around the house in the morning or making sure to do 20 jumping jacks before you leave home, or you're going to walk twice this week. Set something that you think you can do in very real terms. Because once you can do it on a regular basis, even though it may not meet all the guidelines and the criteria, that sets you up for success and doing something, you know, importantly for yourself, which even if the exercise benefit isn't great, sometimes the mental health benefit is awesome. Your goals should align with what your overall health aspirations are. Some people just want to live longer. Some people want to run at the Olympics. It just depends on what your goals are. And you should set a clear timeline as to what you want to do. So you should review and adjust your goals. I mean, if you have a personal trainer, that's someone that can work with you. But setting up a framework to really make this happen and do all these things that we talk about is really important. Okay. And, you know, I think for men in particular, leveraging your network, and those networks that exist in different spaces. You know, sometimes, a lot of times, men traditionally have networks. It might be at the bar, lining with the fellas, but it can also be in a sports group where you go to play football, you play tennis, you have you have a line once a week with someone, and we need to kind of leverage the barbershop. We need to leverage those groups, because it does improve all of these behaviors. If people are intervening and making an effort to be on a group focus to do something better, similar to this initiative by Massy in general, we know that overall is going to improve behavior, sometimes by as much as 70%. Importantly, when you have a partner, so this is where the ladies come in, you know, your partner encouraging you. You know, some men feel that like my wife, when she heckles me all the time about not doing some of these same things, but it is important to have that support from someone close to you that you trust, and someone that can share in that journey with you, because it really helps when something is not right. You know, like many years ago, I found out my cholesterol was really high. I had a whole panic attack, and you know, my wife, she has type 1 diabetes, so she's very comfortable with all of these health conversations 90% of the time. And even me being the doctor, I was quite stressed. But her experience being a patient her whole life really helped me settle down and just decide, well, look, Russ, these are the things you need to do to make a difference, okay? And obviously participating in any group initiatives in your community. I mean, Massy is here, but, you know, we have church groups, we have sports groups. Those things make a huge difference to your quality of life, okay? And we do believe in terms of quantity of life as well. So early screening is vital. More men need to go and get screened. Your lifestyle changes can improve your health significantly in terms of quality of life, but also can extend your life up to 10 years with just these changes: balanced nutrition, regular exercise, mental well-being. Make sure to be consistent. Time under tension, as my friends would tell me, but you have to be consistent in what you're doing, whatever you're doing, and make sure it's something that you can incorporate into your daily practices. And engaging in community and workplace initiatives help bring that all together. Okay. So for the men, I would advise you guys in particular, book some kind of annual physical. If you haven't done it already for the year, you know, you can set a commitment within the next 30 days to do something to check on yourself. Doesn't have to be everything, but even if it's just coming and having a conversation, commit to some healthy habit, whether it's walking once a week, twice a week, connect with community events, and stay proactive. So your regular checkups if something comes up. Don't fall off the wagon if something comes up and then you have to follow up on it. Try to make sure to follow up. All right. So there's the final slide. Your health is in your hands. Take control of your health by making informed choices and seeking help. Commit to at least one health-related action this week. That's for everybody. And I would like to have a conversation. Hopefully, there's some things here that we can talk about. That's really real excitement is. Thank you.
So thank you, Dr. Russell. So I'd open the floor up now to if we have any questions. I will start first. I have a question as a man. So what would you say is the number one reason as us men, we know what is right, the right thing to do. Why don't we do that with regards to our health?
Yeah, I mean, I think I don't think that's unique to men. Obviously, there are a lot of social pressures that exist in the Caribbean in particular, which lead to some of these behaviors in general, both the high-risk behaviors as well as the avoidance behaviors that create barriers in men's minds. Like, you know, I'm a man, I shouldn't feel ashamed about going to the doctor. Even engaging in a conversation like this, we may find that women ask more questions than men. And the reality is that these are difficult conversations because there's a sense of vulnerability, I think, if I had to really relate to it. I think men feel quite vulnerable when something is wrong, or they don't want to know if something is wrong. Some of it is stubbornness. Some of these issues are sensitive. So as I would have discussed, when you have male sexual health issues, that's not something that a man is going to talk about easily. I mean, women probably have similar challenges, but not in the same way, because we are, you know, very much defined by our masculinity and how we can perform. And again, a lot of that is Caribbean based. So I think there are a lot of barriers that exist. It's something that's worthy investigating a bit more. There's quite a lot of evidence around it, but in general, men are a bit vulnerable, and I think the social expectations prevent them from accessing care in the same way. They just, everybody feels this weight of expectation. Sometimes men are too busy in their minds, you know. I just have to provide. I get that a lot, you know, from a lot of the guys working in very laborious jobs and stuff like that. Even the corporate guys, you know, I work a lot, I'm here to provide, and therefore is not I don't have the time to do that, and I can't afford for anything to be wrong. Is the other conversation you get a lot. I can't really afford for anything to be wrong because I have to be here to provide for the family. I could work, I could deal with that when the kids and everybody is okay, and they don't see it on the flip side. So those are some of the things that I've seen in practice. Yeah. So
Okay, thanks for the
uh,
feedback. I go across to the chat. We have a question from Paula. So she says, how can women as partners support men emotionally with erectile dysfunction, knowing that some men are sensitive and proud? How can we make them feel validated when they may feel self-conscious or shame? So, Doctor, you can give your input. We also have Dr. Weller, who's on this call. He's a clinical psychologist, so I'd also like to hear from him after you give your input.
yeah, that would be great. Well, I think obviously the topic of erectile dysfunction can be very complicated. In many cases, there is an organic problem, whether it's something to do with the blood supply or the nerve supply, which is why people with chronic diseases are more prone to it. Now, if that's the case, if we know that that's the case, that's an early segue that can be used. I think I just want you to get checked out, because the reality is that in a lot of cases the perspective shouldn't be that this is the final nail in the coffin. I can't do this anymore. What can I do? It's really that in a lot of cases, if we identify the issue is something that can be helped. To the psychology component of it, there is a big proportion of people where this is due to this is more psychological. There are difficult underlying issues in the relationship itself that might not have been addressed. And that's obviously a more difficult conversation when issues come up. But I find it to be a lot more common than the literature says, where stress, issues in the relationship dynamics, working out those issues first may actually help fix the problem internally, or at least come to some kind of resolution where both parties can feel comfortable. So, I think you need to address it from the perspective that reversibility is always on the cards. It's finding a solution to it is only going to help both partners, and you're there to support that process. And secondly, understanding if there are relationship dynamics that need to be addressed to help solve the problem, because sometimes that's an even harder issue, because people then have to face some tough realities about what their relationship dynamic is like. Yeah?
Yes, thank you, Dr. Weller. Do you want to give your input by chance?
Yeah, I think Dr. Brumwitz has made some important points there. A couple things I would add is, we talk about erectile dysfunction, but most men have a problem with their erection at some point, especially as they get older. This does not necessarily mean they have erectile dysfunction. It can be situational. They could have had too much to drink. They could be tense. They could be angry with their partner, whatever. And I think it's really important that we understand that it's a continuum. It becomes a dysfunction when it's really getting in the way of sexual activity. So that's one thing to think about. Every man doesn't have to all of a sudden think he has erectile dysfunction because he can't get an erection, once every 6 months or some period like that. However, to that point, if you are with a regular partner, if you're with your wife or whoever, and you're having that issue, even if it hasn't become a dysfunction, it's really healthy to be able to talk about it and set the stage for further discussions if it does become a problem, as opposed to pretending it didn't happen or finding some fake excuse or whatever. I think the other point I'd make about this is that, to add to what the doctor said, is that erectile dysfunction can be a function, as I said, of anxiety. So the psychological part may not be about the relationship, but in the same way that the doctor was explaining, hypertension, testosterone, all of these things are linked. That erectile problem, whether it's a dysfunction, may be related not only to the organic, but to the level of stress the person is under, and the amount of sleep they've had, and the amount of exercise they're having, and obviously their testosterone level, etc., etc. Finally, I think the other point I'd make is that if your relationship isn't healthy and doesn't have good communication, you're going to have a problem dealing with the erectile dysfunction, because it's probably a symptom of the relationship but it's going to be affected by the relationship. So it's always good to build those relationship skills, those communication skills, and for the partners to be supportive. So if the woman, the wife, or whoever is aware of this problem, really be strategic about it. And when you become aware, start finding ways to have a neutral discussion about it. As the doc said, maybe by starting with a physical checkup, just to make sure. But this is a challenge that is an ongoing challenge in relationships, and it's a psychological challenge because unfortunately, it builds on itself. The more stressed you are, the more worried you're about your erection, the more likely you're going to have a problem with the erection. So early intervention is really critical. I'll just add those thoughts. Thanks.
I would thank Dr. Weller for that. And to add to his point, the early intervention is so critical. What happens is the cycle that can occur in terms of patients, some of my patients decompensating mentally after many years of not addressing this particular issue is really something that is quite can be quite catastrophic to some people. So finding a way to address it in a non-judgmental way from the partners, from both parties, is really critical to just get a checkup, and then you can allow the doctor to do a lot of the intervention, But again, the person here to have that open conversation sometimes is the most difficult part, and sometimes is very difficult to turn around.
And if I could just add, well, we could go on with this for a long time, but getting a little graphic here, one of the problems that happens is that when there's a problem with the erection and it affects the intimacy, there are many choices people can make, but one of the unfortunate choices is to stop being intimate. And so, put a bigger barrier in the relationship because the man can't get an erection, so he avoid sex. The woman makes her interpretations about it, or the partner, and it becomes a psychological issue of intimacy. When in fact, you can still have sexual intimacy and please each other without having an erection, or the kind of erection you'd like to have. So that's something to think about also when you talk about how you cope with this. Be very careful that if you start having a problem, yes, early intervention is good, but don't throw the baby with the bathwater. There's still intimacy and fun you can have, and it prevents that becoming an issue further on down the line in your relationship. So I wanted to add that one as a practical tip.
Okay, I think that was great. We have a comment from Amanda. She asks if you can speak a bit more about energy drinks, as our males now, as you may know, are using them on a daily basis and is also mixing it with alcohol, using it as what we call chaser here.
Thanks for that. Yes, I mean, there are a lot of practical circumstances that some people have heard about. And it's good to start with I remember when I was at University West Indies in Mona for a period of time, we had 3 deaths on campus during that time due to energy drink alcohol consumption. And essentially what happens is that the challenge with energy drinks in general, while I think using one energy drink or using them in limited quantities is probably not going to be harmful, except the fact that it keeps you hyper alert for the rest of the month. But is that mixing those two things together is generally going to be is not recommended. Okay, I mean, alcohol has both effects. Some different types of alcohol can be an upper and a downer. And in particular, when you mix this with energy drinks, this can have significant impacts on the electricity of your heart. So some people can have cardiac arrhythmias and some people can die as a result. Worse yet, it can excite cardiac issues that may not otherwise be there. So from a cardiovascular standpoint, there's a really critical concern with mixing alcohol and energy drinks. The other issues are some of the issues we would have discussed before. They're very high in calories and sugar content. So using them on a regular basis also is not the most healthy thing for your general metabolic health. The other concern is your alertness or dependence. So you're dependent on these drinks now, and really without them, you can't focus. And then sometimes you can become hyper alert. So there are other mental health issues that can come about. It can disturb your sleep significantly. Lots of energy drink users are not able to sleep well. They don't get, regular sleep because of the abuse of the energy drinks. And in a very similar way, it's very similar in terms of overusing coffee or using too much coffee. A lot of these things are synonymous. Okay. So it's not something I recommend. It is, I've seen, again, poor outcomes as a result of this, and it affects multiple parts of the body. So we want to be careful in the amount of alcohol we use. And in particular, I wouldn't recommend mixing energy drinks with alcohol. And I really wouldn't recommend abusing energy drinks. Some of the newer energy drinks, what they do is they try to add as much energy in this small component over and over. And some of these limits are way in excess of what would be considered to be healthy and normal, but they're still allowed to be sold under the energy drink label. And so you have to be very careful about what you're consuming as well. Reading the labels is a principle across the board, but definitely in context with energy drinks. Yeah. And I think Dr. Weller will be able to give a lot on this too.
No, not a lot, but I just make one really sad point. My cousin's neighbor, 23-year-old who I've met, used an energy drink, then tried to calm himself down with something, I think it's called Narcan. I'm not sure what it was and he ended up with brain death. They donated his organs yesterday. I'm talking real life.
Real life.
23-year-old, healthy, athletic musician, dead just from mixing these things. And I don't think we understand. I mean, you could do it and it doesn't happen to you, but your brother could do it and it happens to him, or your son. So, we have to understand the risk. I'm glad that came up, Amanda, and that you're able to answer it, Doc. It's a serious problem. And in Jamaica, we see the boom, which is the alcohol and the energy drink and the spliff, all commanding to really, I mean, not only affect you physically, but affect your judgment. You do all of that and then you're riding a bike or you're driving a car. It's a recipe for disaster. And a lot of times we don't understand that these are some of the driving forces that lead to some of these tragedies around. So real life, real risk, and we need to be informed.
Yeah. Yeah, I'm sorry to hear about that, man. That's really sad. The other thing I would say is that sometimes we think about, to add to that point, sometimes we think about the long-term effects of all of these health exposures. Everyone sees themselves as, oh, will I develop? Sometimes as a younger person, you may not see yourself in 20 years with a heart problem, or you may not see yourself with cancer, or it's not going to happen. And those are things we worry about. But many times we don't worry about the impact of short-term decisions or poor decisions. And that's really the integration of all of these things that we're discussing, like alcohol, drug use, and so on. Those things can combine to cause you to make life-changing decisions, things that you can never recover from. And to that point, to that example, that's exactly the kind of, sometimes those are very difficult things, and it can just be a mistake. It's nothing purpose work, but you had too much to drink, you get in a violent altercation, somebody shoots you, or something happens. Interpersonal violence is one of the number one causes of death among young men in the Caribbean and the Americas, and it's all related to alcohol and drug use. Yeah. So these are things that you have to keep in mind, the short-term effects of all of these exposures or risky exposures.
Okay, thank you. I will just add a comment. When I was in university and studying for exams, that was like my secret weapon. I would use these energy drinks. So doctor just hit home there when he said, you don't think of the long-term effects in which it can cause in your body. So hopefully it don't have any long-term effects on my body. We have another question from Aline. She says, hi, you mentioned a high rate of sleep apnea amongst our men. I don't think this is given attention it needs. Are you able to share some symptoms and effects with if you to have this treated with the seriousness it deserves?
Sorry. Yeah, so I mean, this is a passionate topic of mine because I see it a lot. We generally will diagnose hypertension, and as we mentioned before, a lot of people come and they get a high blood pressure examination. You see the blood pressure in very high numbers, 150 on 100. Everyone is concerned, but there's a subset of patients who have difficult to treat hypertension. And without being too technical, there are lots of causes for that, secondary causes of hypertension. One of the most common that we see is obstructive sleep apnea. Okay. And generally, this is going to be your patient that is morbidly obese, someone that's quite big. They may have a very, very thick neck or big neck girth. It may also be short. And what's happening in these patients is when they fall to sleep at night, their epiglottis, or there's a piece in the throat that helps open and close for air to pass and protect your airway. This actually becomes shut and can block off their airway while they sleep. So these persons snore excessively. And usually by interviewing the partner, we can get a lot of the information. We can get the diagnosis in real time. So a partner may come in and say, Doc, the husband isn't here. The partner may come in and say, Doc, my husband is gasping for air every night. He's waking up. And then I noticed him falling asleep during the day. He had an accident the other day when he was driving the truck on the road. The guys at work are very concerned about him because he's falling asleep behind the wheel all during the day, and we can't even wake him up. I know that's a classic presentation of obstructive sleep apnea. And when you check the blood pressure, it's through the roof. So generally, these patients have a lot of daytime sleepiness. That's one of the major things that you will notice. They're falling asleep quite easily. It could even be in meetings. You could have someone in a meeting talking to you and they fall asleep in front of you during the sentence. That's a very pathognomic sign. And then they have very, very high blood pressures and lots of snoring at night. And usually these patients will not respond well to usual blood pressure medications. And you need to actually treat the underlying sleep apnea to solve the problem. And the reason is that they're even at higher risk of developing cardiovascular issues like heart attack and stroke with both the sleep apnea and the hypertension and all the all the other comorbidities that exist like obesity and other things that are there. So if you know someone, there's a questionnaire called the Stop Buying Questionnaire, which is a self-administered questionnaire that's relatively easy to use. I'll just put a link in the chat. And you can do it for yourself. And if it's suggestive, you may want to see your physician or undergo formal sleep studies, etc., because that's something that's really common but not addressed enough. One thing I always remember that from medical school. All right. So I hope that answers the question. But yes, it's a serious problem and it needs to be addressed if it is there, and it can be corrected quite with not medication, but there's a special machine you have to use called a CPAP machine, which will help the person breathe well at night and decrease these periods. But what we really would like is that persons are recognized early, and then we can intervene to do the lifestyle interventions to avoid the CPAP machine, because a CPAP machine, this machine you put on your face, is not easy either for those persons that have experienced it.
Okay, great. We are a bit crunched for time here, so this is our final question from Tony. This is directed towards Dr. Weller. Dr. Weller, this month is Men's Health Awareness Month. How do we create a safe space for men to share about mental health challenge they may be going through in workplace or at home?
Okay, well, I use this to just share one quick thing. The sleep apnea is something that's really common. I have it. I use a CPAP machine, and I wasn't snoring loudly. I would just stop breathing. I'm not obese, but I had serious back aches and tension in my body because I wasn't sleeping well. And none of this was identified for years. So, we really have to investigate. I think that survey that you shared is important. The genetic factors, sorry to jump in on this, Tony Ray, but one of the things that men need to understand is what runs in their family. Very often we need to begin with that. We don't pay attention to the fact that our father or uncle or grandfather, had heart attacks, or that our mother or grandmother had diabetes and sugar runs in the family. One of the ways to know what our entry point should be to assess our risk is to look at what the genetic component is. What are the things that we may be at risk for? And I think that I'm sorry we don't have time to hear more from the doctor about that, but with regard to the upcoming men's health, Father's Day is coming up. There are lots of scenarios where men will be talking or will be the focus of attention. I think we need to weave our messages in. We need to be informed by what Dr. Broom-Webster has shared, some of the material he has shared, and try to disseminate it. We can create our spaces. Massy can do some Massy Men Forum, that as well. But we need to start with where the men are. So, the sports groups, the athletics groups, the church groups, the religious, whatever it is that we can access and disseminate information. But our information needs to be targeted. So not a scattershot, but let's look at the things that the doc has showed us are significant and the barriers that prevent men from changing their behavior, and then try to target our intervention in that way. It's been a very valuable session, and I really am glad to see so many men, well, not only men and women have, signed up and have participated. So I, for one, I'm glad that you hit, all these points very, very succinctly and gave time for the question and answer. So thank you.
Okay, thank you, Doctor. So as you know, this session is hosted by MyPulse, so I'll pass over to Katrina, who would just like to share a little bit about the MyPulse.
Hi, everyone. Thanks for joining us. Sorry about that. I know that we don't have much time. We just have a couple of minutes left, and we want to make sure Amanda has a couple of words to say to you. But I just really want to thank all of you for coming together in this space. I see people from Colombia and across all the regions, and for Dr. Broom-Webster in Barbados and Dr. Well in Jamaica. This is exactly what MyPulse is about, bringing us together across all the regions. So I just want to make sure we're going to do a little walk through the app, but we're short on time because it has been such an engaging session and you all have had so many great questions, and perhaps Tony will have a follow-up session diving a little further into this topic. But one of the tools that you have available to you as Massy employees is the MyPulse app. Christian has put the link to registration to the app on the in the chat. So please, if you are not on the app already, please register. It's a way of supporting your well-being on your time in a confidential way where you can find resources to support your well-being journey, and also to get the support of your peers within the app. You can connect with Massy employees from across regions, take part in challenges and journeys together, and we have support groups within the app. So we hope that Dr. Broom-Webster, maybe you can support us within one of those support groups going forward. I think this topic has been really engaging. And so thank you very much, and please don't forget to register. Amanda, I know you have a few words you would like to say.
Yeah, I just wanted to thank, Dr. Broom-Webster for really being so passionate about, engagement of this conversation. From the time I met him and I introduced him, he immediately, jumped in and said, yes, just tell me when. So Dr. Broom-Webster, thank you so much for being, such an engaging, host this morning. We really appreciate what you shared with us. No doubt we certainly will have to have a part 2 and a part 3. Because we are going to continue, these types of engagement conversations. This is what you call real talk. And as Dr. Weller said, and I also want to take the time to say to Dr. Weller, thank you for bringing these questions and really keeping this alive for us throughout this journey. We are now heading into 1 year of MyPulse, and it is a journey that we really want to continue because we really want to make an impact and a difference in people's personal lives. And those are the things that matter. And, as Dr. Broom-Webster said, let's be very, appreciative for what our organization Massy is doing, because we are really putting all hands on deck, the Wellness and Benefits team, Tony, Katrina, thank you, Akin, for, so just saying, yes, I will be the the introducer here. So thank you very much for bringing your questions. But we really want to also, talk a bit about self-care. We want to talk about the MyPulse platform. And we really want to continue the engagement around, the purpose behind that preventative care, those annual checkups, those screening sessions, those conversations that we really want to encourage each and every one of you to participate and just, partner with us, walk with us, journey with us. Feel free to ask those questions. We are extremely passionate about self-care. And to each and every one of you, thank you. I saw we had about 83 devices on. Very good. I mean, it's a business day, and we really appreciate the time being spent just not just with the men, but also with the ladies, because we know we are the ones that sometimes have to, do the little poking. Have you done your annual check? Have you checked it? They say if when we feel something, we must know that, it's something that we're not born with. It's something that just, came up overnight. So it's always important to have things properly checked out. So to each and every one of you, thank you so much. We will be in touch with you or vice versa. And we really appreciate the time being spent this morning for you to journey with us. So congrats, everyone, and thank you very much.
Thank you, everyone. So this is the end of the session. Thanks for joining us. Take care.
Thank you. Bye.
Thanks, everyone.
Bye.
Bye.
Bye, everyone. Take
Thank you very
care.
much. Thank you. Take care. Bye.